All right, the push for a vote on health care reform continues on Capitol Hill. Joining us right now with more, Representative Allyson Schwartz, a member of the Ways and Means Committee. Also, Representative Mike Pence, who is the chairman of the Republican Conference. And thank you to both of you for joining us this morning.
Good morning.
Representative Schwartz, will we see a vote this weekend if the Democrats aren't convinced they have the number that they need to get passed?
I believe we will see a vote this weekend. We certainly want to be sure that the final changes on health reform going forward are posted for 72 hours, and all Americans get to see it if they want to. But we're ready for a vote. We've been debating this for a year, really discussing all the details, both looking at ourselves and, of course, with the American people. But we feel a sense of urgency as we see the number of Americans who really are asking us, really calling on us to find this really truly American way to move forward on assuring accessibility and affordability for all Americans.
Do you think you'll get the votes, though? You're about 10 votes shy right now.
We will get the votes.
Congressman Pence, what do you think?
Well, they don't have the votes right now, and I think the reason is that a growing majority of the American people have rejected this approach. I think the discredited Senate bill, the plan to pass that bill by some deeming procedure in the House without an up or down vote, is going over like a lead balloon with the American people. But the core of this bill, mandating that every American purchase health insurance, whether they want it or need it or not, hundreds of billions of dollars of job-killing taxes during the worst recession in 25 years, a massive government-run insurance exchange. This is just not the approach the American people want. We'd love to see a showdown on this. We'd love to have the opportunity to bring this bill down on the floor. And my commitment to Allyson and my other Democrat colleagues is if we can stop this bill, House Republicans are ready to start over immediately on the kind of incremental, step-by-step reforms that Democrat Senator Ron Wyden has proposed. Other Democrats have endorsed that will bring down the cost of health insurance without growing the size of government.
Congresswoman Schwartz, I doubt you'll find anybody who says that there's not something that needs to be done about health care reform, right. But everybody's got a different opinion on which side should be tackled first. Do you get to universal coverage? Do you get to bending the cost curve and making sure that there are ways to pay for this? And I guess that's where most of the controversy comes in. Congressman Pence just said that he'd be willing to work starting over if this bill doesn't pass and focus on the cost side, too.
Well, let me just say, you said it very well, actually. The fact is that the issue of access to affordable health insurance coverage is very important to people, making sure that they have the kind of protections for...
Well, the cost side is very important, too.
And containing costs is very important. Look, if Mike really wanted to work with us, he wouldn't just be saying no. The status quo is unacceptable for American families. The costs are too high, both for families, for businesses, and for the government. We know we need to take action. We've been debating this for a long time. A lot of these pieces do fit together. Americans know that we just can't say no.
But Congresswoman Schwartz, do you think that this bill attacks the cost structure? Because,
yes, I do. I do. Very seriously. It's paid for. It, in fact, reduces the deficit over 10 years, and even more so over 20. We are working hard to make sure, and this bill does it, to bring down the rising costs for families, because you're seeing 40% increases, 50% increases. That's not sustainable. That's why we're taking action. And of course, we have to take that action to make sure that this is saves money for the budget as well.
Well,
that's
Allyson,
what it does do.
Our guest host today is Jim Nussle, former OMB director.
Hi, Jim, how are you?
How are you, Allyson? Allyson and Mike both. I mean, how do you know the answer to the question of whether this reduced costs or whether it reduces the deficit? I mean, CBO, the Congressional Budget Office, has not yet even had an opportunity to score this, and it sounds like it may be difficult to get this scored in time for a vote so that you have the analysis in front of you to answer the question whether
Jim,
this reduces costs or reduces the deficit.
Well, Jim, number one is this whole business of fixing the Senate bill by reconciliation is a bit of a canard. I don't think the Senate bill can be fixed by reconciliation. I mean, so we can look at the House version of the bill, you can look at the Senate bill. The CBO, as you know, actually said that individual policies premiums would go up under the bill that passed the House. And, you know, the unbroken history of entitlements and government programs is that they always cost many times more than what people say they're going to cost. Look, the American people are rejecting this approach because they know it's going to grow debt, grow deficit. It's not going to lower the cost of health insurance. Let people buy health insurance across state lines. What's wrong with that idea? Let's get that out there and make it a law.
As Mike knows, that's in the Senate bill. It was in our bill as well. So that the fact is that the Congressional Budget Office, which is independent, has analyzed both the House and the Senate bill to reduce the deficit. You've seen that, Jim. We are voting on the Senate bill. So anyone wants to look at that, they certainly can. We're making some changes because we thought there was some, there are not very many of them, but there are going to be some changes in the Senate bill. But by and large, what the Senate bill does, and the CBO has said that it is going to save money, reduce the deficit. It's going to contain the rising growth in costs for American families and for businesses. For our families, for our small businesses, this is going to really help them. This is going to make a positive difference in their lives. And the CBO has said it's going to save us money in deficit reduction. How can we, you know, if that's really a concern of the Republicans, they would be voting for this very reasonable bill. We've aired this with the American people and talked about it. And Jim, you know the process. You were the head of the Budget Committee when we saw rising debt, as you know, and we're all deeply concerned about that. Taking action on health care is going to improve our economic competitiveness for our businesses because they can sustain the rising growth and the health care costs. For American families who struggle every day to pay health bills, this is going to help them as well, and it's going to reduce the budget deficit. We're going to move forward, and we're going to keep working on this. We want to get it done. This real sense of urgency for the American people. That's why we're going to take action.
Congressman Pence, you've mentioned what you'll plan on doing if the bill does not pass. If the bill passes, then what?
Well, you know, I've been ducking that question for about a week. I'm going to duck it one more time. I think, look, this is a government takeover of health care. There are massive consequences, not just for 1/6 of the economy. This will affect 100% of the American people for generations to come. And I believe I think there was a poll out yesterday. 48% of the American people say it's a bad idea. According to Gallup, 3 out of 4 Americans said either scrap the bill and don't start over, or scrap the bill and start over. You know, I don't know what about the phrase "scrap the bill" Democrats in Congress and the White House don't get. The American people want health care reform that lowers the cost of health insurance, not grows the size of government and mandates that every American purchase health insurance, whether they want it or need it or not. But they're continuing to drive in this headlong rush for this big government solution. And I'm astounded by it, and we're just going to continue to fight hard and jump off that bridge when we come to it.
Yeah, it's really unfortunate that we haven't gotten the kind of cooperation from the Republicans that we would have liked. But the fact is that this sense of urgency for the American people who every day come to our offices, whether we're Republicans or Democrats, and ask us for action on these very critical elements of affordability, of access, and a sense of security about being able to have access to health care in this country. We should be able to figure this out. This is truly a really public-private partnership with the American people. It's having all of us take some responsibility, and it will make that very positive difference in Americans' lives.
Obviously, there's a big
bit of difference
of difference between the opinions here, but Representative Schwartz and Pence, we appreciate your time. Thank you both very much for joining us.
Thank you.